Hello, this is Dr. Steve Horwitz from Capital Sports Injury Center. No, this is not a medieval torture device. This is called the Cervical 2000, an amazing cervical spine traction unit. Last March 2010, which is about 5 months ago right now, I discovered left arm pain. I was carrying my 40-pound son on my shoulders at the zoo in DC. We were walking out of the zoo and I noticed arm discomfort. It got worse, a lot worse over the next 10 days, so I decided I needed a cervical spine MRI, and indeed, I have disc herniations, C3-4, C5-6, and C6-7 with canal stenosis. Not really a pretty picture, not something I wanted to find out. By the way, I've competitive powerlifting all my life and never had a neck problem, not one. So this is a good example for patients out there who think pain is the true indicator of health. Pain was not my indicator of health, because I had no pain for 49 years. And then whammo one day. Was it that one day of putting my son on my shoulders? No, it was not. That was a process that was building, but that's a video for another time. I want to show you this unit because this unit saved me. It is a traction unit. It is put on simply by Velcro straps, 2 straps on each side, and you simply pump it up. 3 little pumps. Sit here for 10, 15, 20 minutes. I bought the unit really for me, not for patients, kind of selfish, and I used it for 10 days in a row, 10 to 15 minutes each evening. After the 10th day, the pain was gone. It did not return until I did something somewhat foolish in my workout, and I used it again, and within a week, the pain was gone. Now I use it on a regular basis, 2 to 3 times a week, and feel great. I have not returned to heavy squatting because the bar on my back hurts, and I'd rather reserve the little time I put something on my shoulders for my 3-year-old son, which I have great joy putting him on my shoulders. This unit is an amazing unit. It is so much better than the supine, the face-up traction unit that I've had in my office for almost 20 years that almost every chiropractic or physical therapy facility has. I cannot believe how much better it is. I've used it on patients with headaches, other patients with disc herniations, and within several treatments they're already noticing a relief. I have extra units, and what I found the best thing to do is to have patients take it home and use it at home after I show them how to put it on properly for a couple of weeks on an everyday basis. So instead of having to come here, and certainly in the Washington, D.C. area with all the traffic, that's not always doable. So having it at home and being able to use it daily, sometimes twice a day for short periods of time, we figure out a treatment plan that will work the best, and I keep in touch with patients on email or by phone, how they're doing. It has worked wonders. Cervical 2000 by Meditrac works great. Thank you.